Hello and welcome to my Nutrient Nirvana History, Health and Wellbeing channel. I'm Paul, your host, and with me today again is longevity and anti-aging expert Phil Micans. Hello,
Hello,
Phil. How are
Paul.
you?
I'm all right. How are you doing?
Not so bad, mate. Not so bad.
Good
It's
to hear.
pretty cold and wet this side of London today. Unfortunately, we're heading into winter now, aren't we? But I'm
We
taking
are.
the vitamin D. I'm taking the D, and I'm feeling all
Keep
right.
that D up. Keep that D up. And if you can, get yourself out to the Canary Islands for a week.
That'd
But
be lovely. I'm a bit too busy for that at the moment, unfortunately. But yeah, that would be lovely.
yeah,
Right, today we are here specifically to talk about peptides. We talked about this briefly at the end of our last recording together, and it's not something that I knew much about. I've had a bit of a research since then, and it would seem there's many reasons to be very excited about peptides. So to get us started, Phil, could you tell us exactly what are peptides and can you explain how they were developed into supplement form?
sure. Well, peptides are made up of amino acids. So amino acids are, if you will, the building blocks of life. And some of the amino acids are called essential, like L-tryptophan as one example. Which, what does the word essential means? Well, it means if you don't have them, you die. So pretty essential. And when amino acids join up together, when they can join, and of course that can be, a mathematician will have to tell us about all the numbers of different possibilities. They become known as a peptide. So as soon as you get two amino acids come together, it becomes known specifically as a dipeptide. And some people think that that was the moment in the primeval swamp. You know, if we go back millions of years and bubbling mud pools and all that, volcanoes and all that on planet Earth, the moment that two amino acids joined, information became possible. Okay, so that's a little theory. So, of course, as soon as you start conjoining all these different possibilities of amino acids, you can get much, much longer chains. So, there's a point at which they stop being called peptides and we start calling them proteins. And if they keep on going, there's even points where we stop calling them proteins and we start calling them hormones. But they're all made up of amino acids. Okay. To give you one very long example, there is a hormone called growth hormone, and it's made up of 191 amino acids. So it's a
Wow.
very, very long chain. And
Mhm.
it means that you can't take it orally. It's impossible to take something that like that orally. But what I'd like to talk about with you today are the very short ones, which we term bioregulators, all still peptides. So these would be two, three, or four amino acids. Okay.
Yeah.
And so that's what peptides are in essence. And they are everywhere. And they're in food, of
Yeah.
course.
Yeah.
And for me, my first degree was in what was called in 1981 food and vitamin technology. I think we might call it nutrition now. But I remember one day the lecturer put up a pie chart and he said, this is typically what you find in food, you X percentage of vitamins, minerals, fats, and a lot of fiber. And I remember on that day thinking, why is there so much fiber in food? Because I'm firmly of the belief nature wastes nothing.
Mhm.
Um, or have they missed something? So fast forward to, I found myself in a lecture in Istanbul, strangely enough, in about 2010, and I was listening to a Russian professor by the name of Vladimir Kavinson, and he started telling about how the Russians had found in the 80s that the short chain peptides that are in different food groups that we eat are gene switches. And that for me was a light bulb moment, was the epiphany, because it took me back to that day in the classroom when I'd asked myself the question, is
Mm.
there something else in food they've missed? And now, fast forward, what, 40 years? Yes, the answer was yes, because there are peptides in food, they're acting as specific gene switches to us, and it explains epigenetics in a heartbeat, and it also gives strength to that old adage, we are what we eat.
Definitely. Just as an aside there, because we know now that there are many nutrients missing from the soil because of modern agricultural farming methods, etc. Are these peptides still in the soil? Are they still in the food?
Well, that's a good question, and I can't answer it with my hand on my heart. Um, yes, you're absolutely right. Even studies of organic food today, compared to say, everything was organic in the 1940s, right? But there are studies that show that even organic to organic, we've seen a depletion in minerals like selenium and zinc and others by 30, 40, 50%. So
Mm-hmm.
that's not comparing processed foods with old organic. That's comparing modern organic with, yeah. So that's very worrying. So I think there is a chance that some of these peptides have diminished in the food groups, but it's kind of a hand in glove situation, because if we took, for example, a gene responsible for the thyroid gland, okay, and if we said that we know that this peptide invigorates that thyroid gland to start making more thyroid, it still has to go and find the materials, in this case iodine specifically, to manufacture the thyroid hormones. So
Right.
so now you have the message, but you don't have the material. You know,
Mm.
it's a bit like the foreman on the building site coming down and say, right, lads, let's put some more bricks up. By the way, where are the bricks?
Mm.
You know, so it's both these. It's the front end and the back end of the same operation, if you see what I mean.
Yeah, sure. So my company are currently holding about, I think it's 21 different peptides.
Hmm.
Um, I'd like to discuss some of them with you today. We couldn't possibly talk about all of them in one video, but if we talk about some of the main ones,
Hmm.
so could we start, as you've mentioned the thyroid, could we start with the thyroid peptide?
Yeah, yeah.
Um,
We
so yeah, go on.
That's fine. I think also, Paul, maybe we can do it later. I should tell you about why the Russians did this research and all that, but I'm happy to share with what the peptides can do first, and then perhaps if people then want to know a little bit more about the background, they'll understand how we arrived where we are now. Because what we're talking about now has over 40 years of research behind it,
Mhm.
and that's what most people find. Well, how come I'm only just hearing about it? And
Mm,
we get into that. But the thyroid is a nice one, and a relatively easy one to talk about. So, as we all know, the thyroid gland, which is located in our necks, it's kind of butterfly shaped, has a major role in all, like all hormones, have multiple roles. But some of the key aspects of thyroid are temperature control.
mm,
If you know people or yourself and you have cold hands and feet regularly, you could have a thyroid problem.
mhm,
Sleeping problems, depression problems, and of course carrying too much weight. Everyone says, "Oh, I've got a thyroid problem. I'm too fat, whatever," because it is part of metabolism, of course, as well.
mm,
And so there are actually four hormones produced by the thyroid gland, although T1 and T4, as they're known, are hardly ever spoken about. And most doctors will only talk about T3 and T4. We could go off into that, but to keep it into this peptide situation, most adults, I should say, are slightly hypothyroid. In other words, they're not producing enough thyroid hormones. Okay, there was a great doctor by the name of Broder Barnes who wrote a book many years ago called Hypothyroidism: The Undiagnosed Epidemic, and he estimated that something like 40 to 50% of adults were deficient in their thyroid. Okay, now that gentleman is long dead, unfortunately, but his student, who's alive very much today, a lovely man by the name of Rick Wilkinson, and I've interviewed Rick, and he's written articles that have appeared in our Aging Matters magazine, and he estimated, and I asked him, it was 40 to 50%, all those years ago with Rhoda. What do you think it is today? And he said it's more. So it
mm.
hasn't got better; it's got worse.
Oh, definitely.
So, so there we are. So, so how do we improve our thyroid? Well, we can all find out how well our thyroid is functioning by taking our temperature when we get up first thing in the morning.
Mhm,
Don't take it as gospel on the first one, but if you do it, say, every day over 10 days, have a look at the number that comes up the most, and you'll be gobsmacked how accurate it is. And I can only talk in Celsius, somebody else had to work it out in Fahrenheit, but you should be first thing in the morning, get out of bed, get the thermometer, put it on the forehead, stick it in the ear, as you do now, you should be 36.3 to 36.7. If that's your normal number, congratulations, you've got a nice active thyroid. But a lot of people are going to be gobsmacked that they're 36.2, 36.1, 36, possibly even 35 point something. But the thyroid is so pin accurate, we are talking about point something of a degree. Okay. That's how clever the thyroid is at trying to maintain temperature. And so by taking the thymus peptide, you are going to reinvigorate, you're going to activate a gene, and your body is going to naturally start producing more thyroid hormones. Okay. And you're going to be able to follow that by continuing to monitor your rising from bed temperature. And suddenly, over some days, maybe a few weeks, in some cases, you're going to see it creep up from 36.2 to 36.3 and maybe 36.4. But it's going to just creep, but to get you in to this band. So it's not like taking a thyroid hormone, where if you swallow a thyroid hormone, you're going to put that thyroid in your blood. And therefore, it is important that you monitored the amount of thyroid you have circulating in you, because if you were blasé to it and just didn't have a control, you run the risk of what's called downregulation, which means that your own thyroid gland may stop making thyroid because it's in abundance. What on earth do we need to do this anymore for? And that can happen. So one doesn't do that. But the peptides don't work like that. And this is the strangest thing about them, that it's not clear why they do this. But let's remember, this is the message in food. So it's something that we've evolved with, okay, over probably millions of years. If it raises the thyroid, just to keep the thyroid, if it raises the thyroid to within this parameter, it won't allow it to keep going to some stupid temperature like 38 or 30. It actually would stop at some point and then silence the gene, because the gene is either on or off. There's no middle ground. It's either silenced or it's activated. And so by a process I don't think that's really understood even by the Russians who've been researching it for 40 years, it actually bioregulates. So here's the weird thing, right? If you were one of the few people that's hyperthyroid, in other words, your body temperature is over 36.7 and you've got too much thyroid circulating in you, it silences the gene and brings you back down.
Wow, that's amazing.
And it could explain why in over 1 million dose cases that I should say the Soviets, because this started when they were the Soviet Union. And of course, this is not just Russia. We are talking about Azerbaijan and Kazakhstan and Ukraine and the other Russian-speaking countries here. Okay, Georgia, Armenia, etc. This is not just Russia, because it was the Soviet Union. That they have not, to date, seen one serious side effect. Not one.
Wow, that's great. Yeah, brilliant. Okay. So just to clarify, if someone has been taking, I don't know, thyroxine, would they need to stop taking that to take the peptide for the thyroid, or could they take both simultaneously? Could somebody take the peptide for thyroid and carry on with their iodine or selenium supplementation? What would be the correct protocol?
Coming to the hormone, to the thyroxine, the answer is they can be taken both together, with one caveat, and that is that the patient should monitor themselves much more closely, because there is every chance that they will need a lower dose of thyroxine.
Right. Okay.
Possibly even don't need it at all. You know, it really does depend on the condition of the patient, the need, etc. There's one time that these peptides will do absolutely nothing for anybody, and that is that the gland or tissue has to be present. So in other words, if you've had a thyroidectomy, if your thyroid gland's been removed, then you're stuck with the hormones, because it ain't going to do nothing for you. Okay, you need the gland or tissue to be present. I know that's a minority, but there are people out there with that problem. So the short answer is yes, they can be taken together, but if you're taking the drug per se, monitor yourself closely. There's every chance you will need less of that drug, possibly even none of it at all. But if you're taking, say, iodine, for example, I'm less concerned because now we're talking about the building blocks. And the only thing that you probably would cause a problem is waste your money. Because if, for example, the thyroid gland, the peptide has done the activation and it's put you in the normal band and the material like iodine, etc., has been available, because iodine is required to manufacture the T3, T4, etc., thyroid hormones, then maybe there'll come a point where you don't need the peptide anymore. But here's the good news: you don't have to take these peptides every day. In fact, the typical protocol, is to take them for 10 days every month. Because once you've activated or silenced, it's done. You
Right.
know, it's like, is my fax machine on or off? You know, there's no middle ground. And then actually check every now and again. So there is necessary to do some repetition, and some people do it as little as every 3 months. So imagine that you have 10 days of treatment every 3 months. But in majority of cases, most people are doing that every month. But
Right.
unlike a drug, also even some supplements, there's certainly no need to take them every day, not unless the condition is severe.
Serious. Yeah.
Yeah, yeah.
Sure. Okay. Thanks. Okay. Thanks for clearing it up, Phil. How about the pineal gland peptide? This really fascinates me. I guess this is to do with the production of melatonin.
Hmm. Absolutely. I mean, I think we may have spoken a little bit in our first one about the pineal gland. It's one of my favorite subjects
Mm.
because there's so much that makes the pineal special. You know, it's pea-sized, and it's kind of in the center of our brain, right in the center of our brains. And by manufacturing melatonin during darkness, and I didn't say nighttime because it could be darkness, 2 o'clock in the afternoon when you're watching a film in the cinema, and you
Mm.
make you feel a bit tired, and that's the reason melatonin is
Mm.
being produced. But it's a signal to the other endocrine system, the rest of the glands that produce hormones, when it's night and when it's day. And why is that important? Well, you get this circadian rhythm, right? Day, night, day, night, day, night. And that's when the hormones have to know when to release. Now, most of them release first thing in the morning, which is the get up and go impetus for us, but not necessarily. There's what's called pulsate releases of various hormones, other like growth hormone. Take that as an example. Most growth hormone is released early in the morning. Pow, let's get on with the day, right? But there are several smaller points of growth hormone release in blood during the day and leading up to night. But if the body doesn't know when it's day and when it's night, all that gets mixed up, messed up. And this is one of the reasons why anyone on shift work or is regularly on a jet plane going long distance gets really messed up. And we have a lot of ladies who are working on the planes who have menstrual problems, who can't have children, have great difficulty having children because their body literally doesn't know. Because once you have hormonal cyclicity, thanks to the pineal gland and melatonin, you have hormonal cyclicity. And when you've got that, you've got a very strong immune system as well, on top of everything. So that's why the pineal gland, it's not the only hormone the pineal gland produces, but it's the one we know most about. But there's another aspect to the pineal peptide that I think is fascinating. And this is being borne out partly by the Russians again, but that I have to admit that was in animal experiments, but more recently by an American doctor by the name of Bill Lawrence, who spoke at our conference in September in England, which we called the Profound Health Conference. And by the way, today we released the videos.
Ah, today, really?
Hot
Right.
off the press, first announcement.
Where can we find those, Phil?
I'll give you a thing you can put in the link.
Yeah, lovely. Appreciate that.
No,
Cheers.
no worries, no worries. So people can watch all these speakers that came to talk and see all their PowerPoint slides, etc. So Bill Lawrence, he came to talk, and what Bill had done is he'd taken the Russian studies, which we can get into, and he said, I'm going to duplicate these in the US. So he had 39 patients, aged between sort of 45 and about 70 something. And over 3 years, he monitored them for various parameters on when they were on the peptide program as defined by the St. Petersburg Institute of Biogerontology, who the head man there is Professor Vladimir Karamsov. And by the way, he was at the conference, so you can listen to Professor Karamsov talking about this as well. But what Bill found is two of the most important measures today. If you're deep into anti-aging, longevity medicine, whatever you want to call it, two of the major things that you might want to know is how long are your telomeres and how is your DNA methylation? Okay. And we can go off and describe what they are. But fascinatingly, in all of Bill's patients on this peptide program, all of them extended their telomeres and all of them improved their DNA methylation. Now, as we age, that should go the other way. Not get better, not even stay the same, but get worse. These people all had significant improvements to both those factors. So we think that the primary motivator in that is the pineal peptide.
Right. Okay. That's very interesting. I know there's a lot of scientific evidence that points to astragalus, an adaptogenic herb, being able to increase the length of the telomeres. Have you heard of it at all?
Yes, there's a famous supplement that's an extract of astragalus, and it's called TA65, and it's been around for several years. It is perhaps the best known, and to their absolute credit, they have, to my knowledge, at least two clinical evidence, human clinical evidence, that it extends telomeres, and so that is a very good product. The only thing I have a downer on TA65 is it's expensive. You know, it typically runs to about $600 a month. So it can be too expensive for some people, I would say, but they have evidence and it does work. So that's very much their credit. If you were to use the pineal peptide, I would suggest that the cost, I don't know if you want to get into cost, but it's part of the cost and convenience, right? All things in life come to cost and convenience. And it runs to about $79 a month. So it's a significant difference. There are lots of natural things that can slow down the loss of telomeres, for example, but there's very, very little that's been shown to extend telomeres. So you can imagine, say, well, what sort of things will slow down telomere loss or halt telomere loss? Well, believe it or not, exercise, good food, low stress. Stress is the number one. High stress is if you want to shorten your telomeres, get some stress into your life.
Right.
I don't think anyone's thinking like that, are they?
I find that magnesium is usually the best thing for stress.
True.
In my experience.
True.
Yeah. Okay.
I'd go on to one of my favorite amino acids, L-tryptophan, you know, which leads to an increase in serotonin, and the serotonin is a very calming neurotransmitter. I'm sure we're all aware of that.
Yeah.
Makes you feel chilled, right? So
yeah, it's very high in turkey, isn't it? Which is why at Christmas time everyone has their turkey and then falls asleep in front of the telly afterwards.
Or if you heat a glass of milk up, grandma, you know, you weren't sleeping as a kid, and grandma would say, well, let's have some hot milk. And you drink your hot milk, maybe have a bit of cocoa in it, and then next thing you know, you're sound asleep. Well, again, same reasoning, same thing. When you do that, it breaks the bonds in the milk and it releases a lot of tryptophan.
Yeah. Brilliant stuff. Okay, so let's move on to the next one, Phil. I've got blood vessel peptides. So this would be for the vascular system.
Absolutely. You know, there's again, I know we've touched on this before, but a guy called Kenneth Kenzie, who was American cardiologist, wrote a terrific book called The Blood Thinner Cure. It's probably more than 10 years ago now, but it's still a great book. And in it, he evaluated all the typical markers in blood that are used to evaluate its condition: cholesterol, triglycerides, homocysteine, HbA1c, all sorts of things. And he came to the conclusion that the two most important factors in blood to evaluate your risk of a heart attack or stroke, bar none, were your blood viscosity and your arterial stiffness. So, in other words, if you've got relatively thin blood, not thick blood, and if you've got relatively soft arteries, not hard arteries, you reduce your risk of heart attack or stroke dramatically. And so the good news is that the blood vessel peptide appears to have two roles. It appears to reduce blood viscosity to some degree, but it also appears to increase nitric oxide release. And nitric oxide is the gas that is in the end, that's produced in the endothelial layer. This is a very, very thin layer on the arteries. And once that happens, there's a certain amount of dilation. There's an increase, and that, as you can imagine, leads to improved blood flow, and even to some degree reduced blood pressure.
Wow.
So there's other factors here as well, but it's the old story. And Professor Cavinson today, he's got programs. So he will say, you know, if it's this problem, I recommend this peptide and this peptide. And he's got combinations because things work in synergy, right? Things that you get a bigger bang for the buck when you put things together. And when it comes to all the peptides, if you want extra, he always recommends a blood vessel. And when you think about it, why? If you're improving blood flow to a cell, you're improving the chance of the cell taking the nutrition it needs.
Yeah.
And secondly, if you're improving the blood supply away, you're improving the chances of removing the toxins.
Toxins, yeah. Makes perfect sense.
Yeah. So it can have a universal effect.
Very interesting. Okay. I've got adrenal. Now, adrenal peptide. Now, I know that you've taken this one, haven't you? Because you were experiencing some issues in the late afternoon, I believe, where you were feeling a little bit tired, which is very common these days. I think sometimes that can be a blood sugar problem, can't it, as well?
Yeah.
So maybe too many carbohydrates at lunch, etc.
Yeah. Well, that could have been my problem because I've always been a bit of a carbohydrate king, much to my dismay. But yeah, you're absolutely right. Although I've never been a big lunch eater, I'm the kind of guy who likes a decent breakfast and an early dinner.
Me too. I generally just eat 2 meals a day.
Exactly. And if I have something for lunch, it's normally something very light, small soup, bit of a salad, something like that. That's the kind of way I like to go through the day. But you're absolutely right. It can be a blood sugar issue. So one could do it. But there are a lot of people out there with adrenal fatigue. There's a great book, great books on adrenal fatigue out there. I'm not going to forget the name of the author of one. I've forgotten that, but I'll find it. We can put it in the link. But a lot of people will be aware of this. So the adrenal glands are two glands that sit on one each on top of the kidneys, and they actually produce a lot of hormones. They including DHEA, which has an abysmal long name of dehydroepiandrosterone. But basically, yeah, don't ask me to spell it. That's the trouble with this game, Paul. It's like learning a new language. But it is actually the most abundant hormone in human blood. Okay, it's the most regular one, and it's produced by adrenals. But the adrenals produce many other hormones. There's aldosterone, there's cortisol, which is quite a damaging hormone, of course. And so it can go right. In fact, cortisol is one of the very few hormones that can increase as we get older. Most hormones will decrease as we get older, but there's a couple like prolactin and cortisol which can increase. And cortisol has sometimes been called the dark hormone because it is very stressful kind of. Anyway, but anyway, by getting the adrenals back in balance can be very useful. And you're absolutely right. The adrenals, if they're fed properly, if you're eating properly and you're eating at reasonable times, then yes, that's a very good thing to do. But a lot of people will be out there saying, well, that's definitely what my doctor said. I've got adrenal gland failure, blah, blah, blah. So I found that, and I thought I had that some years ago now. And one of the first peptide bioregulators I decided to take was the adrenal. And I found that within 2 to 3 months, I didn't have the problem anymore. I was leaving a normal day without having to have a nap at 2 or 3 o'clock in the afternoon. Yeah. So, and as far as I was aware, I know this is not very scientific, but as far as I was aware, I hadn't radically changed my lifestyle or eating habits. So no, not a nice part. And that's, and again, going back to this point, you don't take them every day, you know. So it's not something you have to open every morning and do. Although initially, it's probably a good idea to take 2 capsules a day for say a month, and then come down because you've made the improvement and now you just want to do a maintenance.
Yeah, sure. Okay, makes total sense. The cartilage peptide. I
Mm.
suppose this is for regeneration, isn't it, of
It
cartilage?
is. This is a big thing, and most people, when they hear that word, that magic word, regeneration, they don't believe it. But believe you me, it's going on.
Mm,
And without wishing to sound repetitious, one of our speakers at the Profound Health Summit was a fantastic surgeon, Italian surgeon, by the name of Valerio De Nicola. And Dr. Nicola, through the University of Rome, is now regenerating cartilage in people's knees and hips and negating the need for knee and hip replacement.
wow, that's incredible.
And that's where we want to go. That is the future of medicine. Let's assist our bodies to repair themselves
Mm,
like they did when we were 20 and 25 years old, right?
mm, yeah.
So cartilage, when it comes to the peptide, there's a number of aspects going on here, okay? And I'll come to the third one, which I only learned fairly recently through Dr. Nicola. So the first one, of course, most people think it is simply a lack. So if we imagine a knee, because it's nice and easy, so we got, we're talking about the two knee joints, and of course around the bone there's cartilage.
Hmm.
Okay, so what people imagine is that the cartilage has eroded, decayed, and the bones are touching each other. Well, according to Valero, the surgeon I'm telling you about, that is rare because if it was, the pain is excruciating. They were his words to me. Excruciating. Not a word you hear very often, but I think we all know what it means. So he said, what normally happens is other things. So first of all, there is a loss of cartilage, and therefore it could have thinned. Okay. There is also a loss of the fluid that sits. It's like a shock absorber when you think about it. There's in a shock absorber there's oil. In a
Mm,
knee there is synovial fluid, and that can be supported. There's a good supplement that supports that, which is hyaluronic acid,
mm,
otherwise known as hyaluronidine. And a lot of people out there are taking glucosamine, and actually, it's okay. But when you take glucosamine, what you're trying to make your body do is produce more hyaluronic acid.
mm,
It's better to take, in my opinion, hyaluronic acid or hyaluronidine if you want to do that. So that's the damping fluid. And there's a third thing, and the third thing is the cartilage, and it's a general aging problem. This is, we are become over calcified. Now we can
yeah.
go back to magnesium here and say,
Mm,
if we're low in magnesium, we're high in calcium. And so
yeah.
we address that balance, and that's a good
Mm,
thing to do.
hmm.
Absolutely good thing to do. But what's happening here in the cartilage with this excess of calcium is it has hardened the cartilage.
Hmm.
Okay. And once it has hardened the cartilage, the nerves that reside within the cartilage, they end up being stretched,
Mm,
and they're in what you might call an unnatural position. And
right.
when that happens, it means that when you move, you go, ow, ooh, ow, ooh. So what you find with the cartilage peptide is it's addressing all three of those factors.
Mm,
It's helping to manufacture more cartilage. It's helping to improve the viscosity of the synovial fluid, and it appears to have an anti or a reduction in calcium as well
right. Yeah.
at the same time.
It's
So
very
all those things,
That's very interesting because we're told that cholesterol is the main cause of problems with heart disease, heart attacks. But as I understand it, it's actually the calcification of arteries that
yeah,
is the main catalyst of heart problems, if you like. So it just goes to show you how important magnesium is as well for people to supplement with.
absolutely, absolutely. And of course, going back to magnesium, you're going to see a softening of the arteries as well. And if you go back to what I was saying about what Kenneth Kenzie was saying, it's blood viscosity and hardness
Yeah.
of arteries that are the
Mm,
most important problem,
yeah.
not cholesterol and not
Yeah.
other. Well, there's a
Fantastic.
whole cholesterol story there, which I think we did last time, but there's
Yeah. Great. Okay. Let's talk about the Retina peptide. This is very, very interesting. So, what can you tell us about the Retina peptide, Phil?
well, there's a clinic in St. Petersburg, and it's called the Tree of Life Clinic, and it's run by a lovely lady by the name of Professor Svetlana Trofimova, and she is an eye expert, and that's what they do predominantly in the Tree of Life Clinic. And they turn around people with all kinds of eye problems, severe eye problems that you wouldn't believe. There's quite a rare disorder called retinal pigmentosa. They treat it. They may even be the only clinic in the world that can successfully treat it. We've not heard of another one. But of course, they deal more with like macular degeneration, age-related macular degeneration, and other eye problems. Now, I will admit to you, they do use the injections as well as the capsules. But the injections are because, of course, now we're talking about severe problems, severe. And did she come and talk at our Profound Health conference? Yes, she did. So again, if you want to get the videos, you can see this lady talk, and you can see the before and after pictures. So what are the before and after pictures of an eye? How do you? Well, what they're called is fundus pictures. It's like the back of the eye, and then they've got a computer generated version. So if you imagine the back of your own eye, and then imagine the computer had colored it for your vision. So if there was black on it, it means you have no vision at all. If you have red on it, it would mean your vision was very poor. If you had yellow, it would mean that your vision was, affected. But if you have green, it means you have normal vision. So can you imagine that they take some of these patients in, and in this particular case, they inject the retinal peptide not into the eye, no, because there are things that are injected in it, but not these peptides, but the orbit of the eye, the recess in the skull, and so just subcutaneously, just like 1, 2, 3 millimeters under the skin, they make pinpricks of the injections around the eye like that, and they do that every day for 10 days, and then they give the pills to the patient, and then they come back in 6 months or a year or whatever the case is, and they repeat it. But they have got the most incredible before and after pictures. I mean, when you've got the most extreme cases, I mean, there was one lady, she was 90% blind, 90%, not 19, 90% blind. And through the peptide treatment, they got them back to 30% blind.
Wow.
So she had some vision. So but they've got people who are like 30% blind, and they get them back to near normal. It's always the same in disease. It's always the same in disease. The earlier you treat it, the better the results will be. Which is why I believe preventative medicine must be the future.
Definitely.
And that we must be changing. If there were true anti-aging clinics that we went to every 6 months for a checkup, we could be told, listen, if you carry on like this, in 2, 3, 4, 5, 8, 10, you'll have cancer, you'll have this, you'll have that. So we make these changes now. We change your habits and your lifestyle and supportive aid so that you don't go down that path.
Yeah.
That's what it's about. So the retina peptide can be taken orally, and it does have some pretty amazing, especially for macular degeneration.
Advice, Phil. We started selling a product called CanC, which is famous for removing cataracts. But is it beneficial at all for other eye problems? Do you know?
Yeah, it can be. I mean, you just made an incredibly profound statement, because most people out there would say, hang on, you just mean to say there's an eye drop that dissolves cataracts? I mean, most ophthalmic surgeons out there have never heard of it. Guess what? It's also Russian research. And actually, that came from the Helmholtz Eye Institute in Moscow, which is the place that gave the world cataract surgery all those years ago. And back in the 90s, they recognized that because of the prevalence of what's called senile cataract, right, that there wouldn't be enough surgeons with the aging population and the expansion, but there won't even be enough surgeons working, 10 hours a day, 7 days a week, to do enough cataract operations. So they started saying, is there another way? And they discovered a dipeptide, which is called carnosine. So that's 2 amino acids. When placed into the eye, and there's a specific technology for that, as an eye drop, in 89% of cases, reduce the cataract, in some cases completely. So the cataract is actually the crystallines within the lens of the eye. So the lens of the eye sits within this fluid called the aqueous humor, and it becomes cloudy. The word cataract is Greek for waterfall. So it's a bit like, I guess, trying to peer through a waterfall, right? Your vision is blurred. basically. And of course, depending on where that is in the lens, it may be in the middle, or it may be off to the side, or wherever. So pretty amazing that CanC, which contains a specific form of carnosine called N-acetylcarnosine, can actually, and clinically, and by the way, it works very well in dogs. It's
Right.
very quick in dogs, and there's a reason for that, which we can get into if you
They,
want
they
to.
sound, sorry to interrupt you there, but they sound a little bit, these crystalline, they sound a little bit like oxalates. That's pretty much
Yeah,
what oxalates are,
yeah.
aren't
It's the process that destroys them, or damages them, I should say, is not actually free radical. It's a slightly different process called glycosylation. And and it could be, well, sunlight, right? A
they?
lot of it is because of sunlight. And there are certain countries in the world where they have very high sunshine. Oh, which is the island? There's a very I might get the island wrong, but it's one of the small islands in the Caribbean. Um, Antigua and Tuga, I can't remember which one, but not only does it have very high levels of sunshine, but they have very little shade. They don't even have a lot of trees or stuff, and they reckon it's one of the highest instances of cataracts in the world. So we know that, sunlight will damage the lens, and of course, as we get older, our defense systems get weaker, etc. And if we don't wear sunglasses and da di da di da, so there's all these things will come into play, but
Mm,
it is, as surgical wise, it is the most common surgery in the world.
mm,
There are, I've forgotten the numbers now, but it's just in America, it's an enormous number of cataract surgeries that
mm,
are undertaken every year. And you can argue it is also the safest form of surgery, and that is very true. But
mm,
the statistics show that about 2% of cases there are complications. So, all surgery has a risk,
mm,
and you don't really want to be that 0.5% person who went blind in that eye because it all went wrong.
mm,
So the fact that that there's a possibility now with an eye drop that it takes 5 to 6 months in the average human. In the dog, it takes 1 to 2 months. It's much, much faster in a dog because the dog lacks an enzyme that we have that kind of breaks it down, called
mm,
carninosine. But I think that's an amazing. But does it do anything else? If that's not fantastic enough by itself, yes, that it does actually help to lower the intraocular pressure in the eye, which is glaucoma. It's not a big bang for that. If people are out there with serious glaucoma, I wouldn't rely entirely on CanC for it. And
mm,
there's a theory about why that may be, and it all comes back to these cross-linked proteins through the process of glycosylation is where protein becomes malformed after reacting with oxygen,
mhm,
basically, and normally glucose as well. And it's an aging problem, and it's also why diabetics are much more likely to have a
mm,
cataract than non-diabetics,
yeah.
because the process of diabetes leads to accelerated, what are called AGEs, which translates as advanced glycated end products. Okay, that's a known measurement. Diabetes, they can test the number of AGEs in blood and say, "Oh, you're diabetic," just by knowing that. But it
Mm,
causes all kinds of damage, not just in the eyes, in the arteries, in the heart, and all kinds of tissues. That's why
mm,
diabetes really is I hate to say this, but it's a fact, is a form of accelerated aging.
mm,
That's one
mm.
of the known factors. So yes, it will help lower intraocular pressure.
Right.
It will actually help against diabetic retinopathy, which again is a problem that diabetics, if you're diabetic, probably every 6 months or maybe every year, you have an eye test to see how your blood vessels in your eyes are.
Mhm,
So yeah, it's got quite a few uses.
mm. Okay, fascinating stuff. I've added a few more peptides. I thought maybe we could kind of address these peptides in one go. We've got
Hmm.
testes, ovaries,
Hmm.
prostate, and bladder. So
Hmm.
they're all kind of connected. I would imagine that these four peptides are going to protect you against a certain word beginning with K, not C.
Okay,
Yeah,
yes, I know
yeah,
that one.
yeah.
Yeah.
So, yeah, your thoughts?
Well, yeah, I mean, basically with most of the glandular base, so with testes and ovaries, and as we said it earlier, if you haven't got the gland, it won't do anything for you. So if a lady takes a testes peptide, won't do nothing for her. If a man takes the ovaries peptide, won't do nothing for him. If a woman takes the prostate peptide, won't do nothing for her, and so on and so forth, right?
Mhm.
But they're about there's very few exceptions, but they are the exceptions. But if a man takes the testes peptide, he's going to see an improvement in his testosterone levels. Okay. If a
Yeah.
woman takes the ovaries peptide, she is going to see an improvement in her estrogens and also in her progesterone level as well.
Okay.
Okay. Prostrate, it's going to be more about reducing the prostate size, and the bladder is going to be more about getting bladder control back so you don't have to go to the toilet as often, which
Mhm.
of course goes hand in glove with the prostate condition, because the first often men are first made aware of an enlarged prostate is could be pain, could be the size that they can feel, but normally it's the fact that they're getting up to the toilet 3 or 4 times a night, and then
Mm.
they go and see a doc saying, "Well, I'm having terrible sleep because I have to wake up every 2 hours to go to the toilet," and that's when they'll go and have a look for an enlarged prostate, of course.
Yeah, just on the subject of that, funnily enough, I've for about probably 15 years now, I've been sleeping using inclined bed therapy, which is where the head of the bed is raised 6 inches off the ground, so you end up sleeping on a slight incline. And
Yes.
I'm happy to report that since we've been doing that, my missus no longer gets up to go to the toilet
All
at
right.
night.
Okay.
So that's something that might be worth looking into,
Yeah. I
possibly.
don't know much about that, but I
Yeah,
personally I like a very high pillow. I'm if I get to a hotel room and see one pillow, I'm always on the phone saying I want two more.
yeah.
So I like to sit with my head. I don't know whether that's got anything to do with it, but I don't
I
know.
think the guy's name that came up with this is, I think his name's Andrew Fletcher. I think I'm getting that right. I think he did an interview some years ago with Clive de Cole, and that's how I found out about it. It's quite a complicated science, but if
Hmm.
you ever look at an animal that's sleeping in a field, on a slope or whatever, it's always got its head looking up rather than down, if you see what I
Hmm.
mean. It's the way
Hmm.
animals do it. So it's a natural kind of thing. So, and I've read before that the ancient Egyptians slept this way. I don't know if that's true or not, but I've read that. So it is a very interesting
Oh,
idea. And I've been sleeping that way now, as I say, for about 10 to 15 years. If
mhm.
I do go to a hotel and sleep on a flat bed, I never sleep quite as well. Never.
Right.
So
Right.
yeah, I would recommend looking into that.
Yeah.
Um, I,
Sleep is important, of course. At the end of the day, I think we've spoken about the necessary to be in a dark room.
yes.
For melatonin production, good melatonin production, some frequencies can cause
Mm,
all kinds of chaos.
yeah.
Uh,
I've got,
I
I've
mean,
got I've got
and you
everything blacked out in my bedroom. You literally can't see your hand in front of your face. It's that
That's very
dark.
good. That's
Yeah,
very good. I
yeah,
mean, the only light that doesn't disturb melatonin production is lunar light.
yeah. I remember you saying that in the last video.
And
Yeah,
there are crystals. It's the Russians again. There's crystals within the lens, within the pineal gland, not the lens, beg your pardon, the pineal gland that seems to have some other properties. And when you think about it, if we go back 10,000 years and we're roaming around the, I don't know, the moors or whatever, looking for a bit of food, night comes and we put ourselves under the tree and we're going to sleep with the stars and that's why it never disturbed us.
mm,
So it kind of makes sense.
yeah. It does. Yeah, definitely. Brilliant. Okay. Okay. We're drawing to a close now. I was going to ask you actually. I've not seen a peptide for enhanced cognitive function. Do you know if
Mhm.
there's one available for that at all?
There is a brain peptide. It's actually a CNS peptide, central nervous system.
Right.
And I'm hearing some good reports with people who have, I hesitate to call it dementia, but they have concerns with it, a specific one that begins with A.
Hmm.
And that seems to be going quite well for them. But if you're talking more along the sort of smart drug and nutrient line, which is you're kind of like a fairly healthy person, but you just want to enhance your memory, cognition, concentration, whatever.
Mm,
No, I don't think they're not in the peptide bioregulator field.
right.
I would be looking towards other substances in that regard. But there is a brain peptide, so people who may have concerns along those lines, but I've never heard anyone say to me, "Oh, it sharpened my memory," or
Mm,
you know,
mm.
I've never heard that specific thing
I know
said.
that people have had some pretty remarkable results with iodine and brain fog,
Yes.
lifting the brain fog with iodine.
See,
So,
a lot of it, Paul, in my early career, uh, because of my mentor was a guy called Ward Dean in America when I lived over there. He wrote all the early smart drug and nutrient books back in the 90s and late 80s and 90s, in fact. And so I got really heavy into this. And actually, when people say to you, my memory's not what it was, you really have to break it down because that is an enormous topic by itself. And I'm not saying all of it, but a lot of it can be actually either boredom, they get bored very easily, they can't concentrate, maybe because of boredom or other reasons. And therefore, they're not retaining things that well
mm,
because they're not actually remembering them that well, right?
mm,
It's a
mm,
problem, for example, if you have to read I mean, like I do, I have to read a lot of boring, what can be boring scientific clinical articles, and then you have to drill down and go back and reread it, and it's quite hard work sometimes. So if you're not that interested in it, it's
mm.
hard to retain it. So
Sure.
a lot of it can be about concentration and boredom. So there is a slight argument, I'm going slightly off topic here, that if you improve your overall well-being, through your energy, let's say you don't have adrenal fatigue anymore, right? If you've now got the energy in the afternoon, you might find your concentration improves.
Mm.
So there are other aspects to memory that are not necessarily always directly brain focused, if you see where
Sure.
I'm going with this.
Yeah, definitely. Okay, I think that just about rounds it up, Phil. So thank you very much for joining us today. You're an absolute wealth of knowledge, mate. And you've got some great stories as well. So
Okay.
brilliant
I,
stuff.
I could tell everyone a joke now, can I?
Go on, please.
This is a Kendo joke. I used to say, people found it very educational. Well, they said it taught them a lesson.
Brilliant. Okay. Thanks for watching, everyone. I've got over 20 peptides on the website now at nutrientnirvana.co.uk. So please check them out. Please like, share, and subscribe. And I'll see you again. Thanks very much, Phil.